Hey guys, welcome to yet another health talk with me, Bokamoso Mthimkulu. So yes, I'm going to educate you on a disease that is known as the main cause of a heart attack. Now, I promise I will try my best to simplify how the disease develops in the body so that you can better understand it. Please, if there is anything that you take away from this lecture, it is the signs and symptoms of this disease, because if they are left to manifest, it will lead to a heart attack. Okay, let's get started. The disease is called coronary artery disease. So this is just the buildup of plaque in the blood vessels that supply oxygen-rich blood to the heart. And yes, the heart also needs oxygen-rich blood supply in order to function optimally. So every organ system in the body needs nutrients and oxygen in order to stay vital and to produce energy so that you can continue your daily tasks with ease. So the way that the nutrients and oxygen travels in the body is through blood in specific blood vessels known as your arteries. Now, your arteries are made up of specific muscle that allows them to expand and to contract depending on how much nutrients and oxygen is needed by a specific organ system at a specific time. But generally it is a nice round circle around the entire body that has nutrients, blood, oxygen, and so forth running through them. So as your arteries pass through the body, through every single organ system, its name changes depending on that organ system. And the main name for the arteries that supply nutrients and oxygen to the heart are known as your coronary arteries. And so we are looking at coronary artery disease. So when I speak about arteries and damage to them and all that, I'm speaking specifically to the coronary arteries. So I want you to think of something that is toxic in your life, something that brings a lot of negativity into your life. It could be a toxic ex, it could be a chocolate cake, it could be anything that is bad, but it must be something that you constantly want to have and that you know is bad for you, but you just can't get enough of it. An unhealthy lifestyle is kind of like that to your body. Unhealthy in terms of obesity, diabetes, eating unhealthily and not exercising, cause that is seen as toxic to the body as well. So I'm kind of putting them on the same scale and trying to help you understand where I'm coming with this. So this toxic thing in your life can cause a lot of damage to you. It could be through a heartbreak. If it's unhealthy foods, it could be through fat deposits in the body, etc. Something similar to where you are being hurt in a specific way. An unhealthy lifestyle does the exact same thing to the body. And in this case, it can do the same thing to your arteries. So in terms of your coronary arteries, you can get damage to them. And when this damage takes place, which is put on by an unhealthy lifestyle, it allows for toxins to adhere to those sections where it has been damaged. And the main toxin that adheres to those walls is known as bad cholesterol. So now you have this bad cholesterol that is adhering to the walls of your arteries, your coronary arteries, and this allows for plaque to form. And over time, more and more plaque builds in that area. So it kind of starts to close the lumen of that artery, which means that there's less blood flow that is going to the heart and specific areas of it. But now you need to remember that this damage can happen over years, sort of like how something toxic in your life damages you as a person or whatever over years. It's not an immediate effect. And then once it is too late, then you start to experience symptoms, and then you're like, okay, maybe I should change my life, or you've too far gone from whatever has damaged you. Now the same happens in your arteries. That effect of damage happens through the lumen closing over and over and over a long period of time, and you start to experience symptoms such as chest pain and shortness of breath when it is pretty much too late. But now if that plaque breaks, it allows for a clot to form in that area, and a clot can wander off and block another part of your coronary artery. And when that happens, it causes a heart attack. And so when you have symptoms suggestive of coronary artery disease, it is good to act to prevent that blood clot from forming and causing a heart attack. So that is it, what happens or how coronary artery disease develops in the body in a nutshell. And now we are moving on to symptoms. Plaque buildup in your blood vessels happens over years and years of adding toxins to the body. So only when there's adequate blockage within the blood vessels will you experience symptoms. Now the main symptoms are chest pain, which is generally in the center or towards the left side of your chest, and it feels like a pressure over that area that lasts for a few minutes. It is generally triggered by emotional as well as physical stress. And you will also experience shortness of breath. Now this will mainly be when you exert yourself in a specific activity. The risk factors of coronary artery disease can be seen next to me. Now, all of these risk factors do cause damage to the blood vessels of the heart, and this damage does promote plaque formation. If you have many of these risk factors, then the progression of the disease will be accelerated for you. If you want to know the different defining criteria of these risk factors, please do click on this tag that will take you to that video where I speak about that specifically. Medications, surgical procedures, and lifestyle modifications are the main ways to manage coronary artery disease. Medications that you're likely to be prescribed are those aimed at treating the risk factors that can cause coronary artery disease, as well as medications that discourage blood clot formation in the blood vessels. Surgeries that you're likely to do could be one that reopens the blood vessels so that blood can flow to that specific part of the heart, or a surgery that aims at redirecting blood flow to that specific part of the heart through another artery or blood vessel. And then lastly, lifestyle modification. I believe that this should be used to complement both surgical procedures as well as medicinal therapies. Now, with lifestyle modification, you want to change your diet and keep it as healthy as you possibly can. You also want to participate in exercise as well as decrease the amount of stress that you have in your life. Getting regular checkups of your blood glucose level, blood cholesterol levels, and blood pressure, etc. is one of the best ways to prevent this disease. But you have to make sure that you also keep up a good, healthy diet, one that's rich in fruits and vegetables and not in processed foods. Exercising is the next best thing that you can do. Something as simple as going for a nice brisk walk, 30 minutes a day, 5 days a week will also help. Guys, also remember that stress does cause a lot of damage on the body, and so decreasing your stress levels will help a lot. Thanks for watching. Don't forget to like this video, share it with friends and family, and subscribe to my channel. Click that bell so you do get notifications when I share more videos with you. Have a great week. I will see you soon. Bye.